In daily life, when small blood vessels are injured, the blood flow out to the small blood vessels, and the bleeding stops after a few minutes. This phenomenon is called physiological hemostasis. Physiologic hemostasis is one of the important protective mechanisms of the body, which can prevent blood loss. How does physiological hemostasis occur? The evaluation index of physiological hemostasis function is bleeding time. In clinical practice, small acupuncture is commonly used to break the earlobe to make the blood flow naturally and measure the duration of bleeding. The bleeding time is normally patient should not exceed 9 minutes. The duration of bleeding can reflect the physiological state of hemostatic function. The bleeding time will be prolonged when the physiological hemostatic function declines. In this section, we will learn the basic process of physiological hemostasis. Physiological hemostasis first shows local vasoconstriction of the damaged vessel and the nearby small vessels, reducing local blood flow. If the blood vessel damage is small, it can make the blood vessel rupture closed so as to stop bleeding. The important mechanism of local vasoconstriction lies in the release of vasoconstrictive substances such as 5-HT and TXA2 by platelets adhering to the damaged area, which cause vasoconstriction. When the blood vessels are damaged and the substance's collagen is exposed, platelets can attach to the collagen of the endothelium. Adhesion of platelets activates their internal signals, leading to further activation and platelets aggregation. Impaired red blood cell release ADP and platelets activation released endogenous ADP and TXA2, which can activate more platelets and cause irreversible platelets aggregation. The formation of platelets thrombus plug the wound to achieve purpose of primary hemostasis. This process is also known first hemostasis. First hemostasis mainly depends on the formation of vasoconstriction and platelets thrombus. In the process of first hemostasis, antithrombus formed can quickly block the blood vessel wound, but it is relatively loose. Further reinforcement with fibrin is required. To activate the blood coagulation system, the essence of blood coagulation is to change soluble fibrinogen in plasma into insoluble fibrin, and the activation of coagulation factors. These fine filamentous fibrin interweave into the network to form blood clot, so as to achieve the purpose of strengthening and preventing thrombus, which is called secondary hemostasis. Blood coagulation is divided into three processes: the formation of a prothrombin activator, the activation of thrombin, and the formation of fibrin. According to the different clot factors involved, the formation of prothrombin complex can be divided into endogenous and exogenous clotting pathways. The initiating factors were coagulatory factor 12 and coagulation factor 3, respectively. When antithrombus plays a hemostatic role, it will be degraded by fibrinolysis system, which can ensure smooth blood flow on one hand and facilitate tissue repair and regeneration on the other hand. To summarize the content of this summary, physiological hemostasis is activated in the body when small blood vessels are damaged, and the fibrinolytic system comes into play when tissues are repaired. There is a dynamic equilibrium between the two, and when that equilibrium is broken, the tissue either bleeding or form a blood clot. That's all for today. Thank you.